connecting patients, co-workers, and communities. This is the Sutter Broadcast Network, the pulse of Sutter Health. This is Sutter Health Reports.
Why did you get into medicine?
Well, I was raised in England, and as a boy there, I read a whole series of books by an author called George Savas, who in fact was early 20th century Russian plastic surgeon. And his stories about his life intrigued me and made me want to be a plastic surgeon, even before I really knew what plastic surgery was. Further, my parents, my father in particular, had been interested in medicine, and because of the economic times in pre-war Britain, his family didn't have any money to send him to a medical school, but he always encouraged me, but didn't force me. It was just an encouragement. As time went by, I became more and more interested in going to medical school and in becoming a physician, and indeed, that's what I did.
Surgeons do have a reputation of being good with their hands and not good with people. But do you think that's actually not necessarily true?
Absolutely not. Surgeons do have an approach which is different, and they should have. They're surgeons, they're not something else. At the same time, we are still treating people. And it's that piece of being a surgeon which, in my opinion, makes it so satisfying. Indeed, operating itself is a very satisfying thing to do in and of itself. But even better is the interaction with the patient, interaction sometimes with the patient's family, and the results you can achieve. So I think, to me, there's far more to it than the technical aspect of surgery. Although I never describe a surgical procedure as easy, I think it is relatively easy compared to matching the technical skills you have to the needs and the betterment of the patient. And having said that, I think we should differentiate between the science of medicine and the art of medicine. I would never underestimate the value of science to medicine. Many of the things that we have achieved today that could not have been achieved 100 years ago or even 15 years ago, we could not do without advances in science. But generally speaking, science treats diseases or disease processes. Physicians treat people. Patients are people. We're all human beings. And it is this conversion, this bringing together the knowledge and the skills you have of a physician, the science of being a physician, to bear at the same time on the patient's welfare and considering the patient as a human being, what that patient as an individual needs, what their fears are, and they all have them. Most patients who beyond the common cold have some fear in what's going wrong with them. How do you consider those things, bring them together and say, this is the science, this is the patient, this is the disease, this is the family, this is what the patient wants, and sometimes they're not sure what they want. And that is the art of medicine, how you bring those things together to arrive at a treatment system, systematology, protocol, which is designed for that individual, not for that disease process. We have so much information available these days, so much, magazines, internet, you name it, television, radio, that patients, people, have enormous opportunities to learn, but they have very few ways of sorting that information and personalizing it themselves. How do you take this massive information, some accurate and some incidentally not accurate, and say, this is what I want, this is what I need? And I see one of the major roles of the physician as an interpreter and a tailor, to interpret the information the patient may have. Some have none, some have a lot, some have in between. Take that information, interpreting it, and then applying it to the individual. What do you want as a patient? What would you like as the outcome? Well, sometimes the outcome they would like is not achievable. That's life. But often many elements of it are. And one can certainly limit treatment, extend treatment, offer different treatments, depending on the patient's circumstances and what they see as their ideal outcome. And I believe the outcomes are best when all people get together and the decision is made based on the art of medicine as well as the science of medicine.